Welcome back to Coffee and Conversation AI in Healthcare. I'm Jen Hand from Informatica, and we're here today with Ylan Kazi, Chief Data and AI Officer at Blue Cross Blue Shield of North Dakota. Thanks for being here, Ylan.
Yeah, thank you, Jen. Great to be here.
So just to give a little bit of background, Ylan leads the Enterprise Data and Analytics Solutions team with a rich background in analytics, data governance, and creating data-driven cultures. So his journey includes United Health Group, Children's Mercy Kansas City, and many more. And we are excited to pick his brain, hear some insights, and we are ready to dive in. So at BCBS, North Dakota, and in your work there, you lead analytic capabilities and modern data governance practices. So how do you see the role of AI evolving in healthcare analytics? And most importantly, I'm curious about innovations that you see happening in the health insurance space, which is, I think, one not often talked about in the realm of AI.
Sure. So I really see AI becoming just a more foundational component for how healthcare is not only paid for, but also delivered. I think in the past, and particularly within healthcare, AI was seen as kind of this cool, shiny object. But it always seemed like the actual application of it was just over the horizon. And I think particularly over the last probably 5 years or so, we've seen it start to be used a lot more, both on the provider side and on the payer side of healthcare. So when it comes to the payer side, one of the areas that I've seen it really be applied to is around the entire claims and the payment process. So the way that healthcare is paid for is it's extremely complex. It's not like you go pay for a service, that's what the price is. There are a lot of nuances that are a part of it. And a lot of that has been automated over the last few decades, but there's still room for opportunity. And we're starting to see AI used a lot more within it to just ensure that the payments are coming in a scheduled time, that the claims are correct, and that we're really trying to reduce administrative burden on the many professionals, including clinicians that are a part of the process. So I would say that's a really big one. Another one that is starting to become more common, both with your traditional AI and even generative AI, is its application to customer service. I think this is another one where there are obviously a lot of complexities around what types of services are delivered and even the questions that members or patients may have around it. This is where generative AI can take away some of the burden from those customer service centers, and really be utilized to just deliver better answers and just have an overall better experience for the patient.
And I'm wondering too, as you're saying that, how that innately ties into keeping members happy, keeping members engaged, because if that takes the burden off of some of the health plans to do that kind of thing, and using AI to kind of have that on demand, have that ready. What are your thoughts on that? Do you think that ties into kind of member engagement and loyalty as well?
I do, and I think it's been a long time coming, and I'm glad that it's finally here. We think about, like, if you think about an amazing experience, you think of something like Amazon, where you order something, it's very seamless. You have amazing customer service along the way. You know exactly where you are at every step in the process. Healthcare isn't necessarily there today, but I think it definitely could be with the right usage of AI. And frankly, if as a healthcare payer, you can just deliver a better member experience, that's going to help in terms of competitive advantage and both in member growth and retention. So I see it as a huge benefit to our industry.
Yeah, and I think like any tool, having people adopt it, and AI now is becoming more and more just the norm. And yes, in prior years we were using AI, but it hasn't created the same sort of buzz. But I think if someone accesses their member portal and goes in to ask a question or find the right course of care or whatever it may be, having that be seamlessly integrated and helpful, and I think that allows for more people to adopt it and more people to kind of just have that sort of like that take off, reach that tipping point kind of thing.
Right, right. That's a great call out. And I think it really comes down to the more usage that people have, and not just in healthcare, but in other industries, they develop more of that comfort level. And so it's less about being fearful of it and more about thinking if you can have an overall better experience, why not utilize it?
Yeah, and I know in your work you've mentioned the fears about AI, sort of people getting scared that it's going to replace humans and that, okay, maybe this is overblown and that AI can actually change the world for the better. So, in relation to our current nurse shortage, I'm curious, how do you see AI helping nurses without feeling that fear that it'll replace them, and physicians as well? But I know
Mhm.
that the nurse sort of kind of is in a lot of conferences and events, that's now a new theme and a new track. So I'm curious in sort of relation to that, how do you think that plays out?
Yeah, so one of the historical analogies that I look at whenever we're thinking about technology and how that impacts the workforce, the one that always comes to mind is farming. And so, in the very early 1900s, anywhere from about 35 to 40% of the entire American population was involved in farming. So pretty high percentage overall. With the advent of more mechanized farming and just agriculture research and technology, now it's about 1% of the American population. And yet you see a much greater supply of food, a surplus, much higher yields. So I utilize that as an example because I think with not only the nursing shortage, but just with clinicians in general, AI is going to really help them extend their capabilities. And I think that that's very important, particularly when you think about rural healthcare, where you don't have many doctors and nurses, and where you do have them, they're serving just huge areas of that rural community. And frankly, it's very challenging. And so I think that that's one specific area that comes to mind. But then even when it comes to some of the administrative work that a doctor or a nurse has to do on a daily basis, why not utilize AI for that so that those individuals can focus more on direct patient care, which is where they can just bring a ton of value to the overall patient experience and in helping to improve healthcare outcomes.
Yeah, and I love that point because I think if we can remember the why, essentially, like it's actually helping to deliver better patient care and allowing people to connect where it matters or where they're needed versus taking away, it's sort of adding versus taking away. I think that's such an important point. And I know, just it's event season, and so I've been at events and heard different recaps from events, and I think this is now a big theme of, it's not on the horizon anymore. It's here. People are utilizing AI in nursing and for physicians, and whether that's just admin related things or deeper, more involved related tasks. But it's like it's here now. So it's
Mhm.
almost like we're either adapting and utilizing and learning and getting feedback, or we sort of regress almost.
Right, right. And I think it's hitting ahead right now, especially because these are problems that are here and now, and we have to be able to solve them. You're not going to solve any type of staffing shortage in 6 to 12 months. It's usually a longer term challenge that has to be addressed. And I think AI in general can really help to solve components of it or portions of it. And at the end of the day, I think too, with AI professionals working hand in hand with clinicians, that's really that ideal. And at the end of the day, it really should be that any nurse or any physician makes that final decision around anything patient care related. But I think AI can offer things like recommendations or even things like differential diagnosis that could possibly help that individual make a more data-driven decision.
Yeah, and this is one of my favorite topics. I think it's just in 5, 10 years, I think it's just going to be so exciting to see where this goes.
Hmm. It is.
So you've expressed concerns, and I know a lot of people have sort of two strong opinions on responsible AI, on sort of like, no, let us innovate side versus a no, let's regulate side. So as far as responsible AI being more about censorship and control and actual responsibility, so I'm curious, who do you think should define responsibility and what that means in the context of AI, and how can we balance that need for the ethical guidelines without stifling that innovation?
Yeah, that's a great question. Um, So in terms of who should be responsible, I think that's probably the question at the heart of the matter, because now what we're seeing is different types of governmental organizations or even large companies or private organizations that all want to be in the driver's seat when it comes to defining it. The problem with that is if you have one organization or one entity that makes up all the rules for it, there's always that risk of censorship and even stifling innovation. I think when it comes to many of the industries already, any of the industry ethics can already be applied to it. And so I think when we talk about things like responsible AI, there really isn't a clear definition of what that is. I think it differs, person to person, organization to organization. But if I'm thinking about it from a healthcare lens, I think about things like the Hippocratic Oath, right? Do no harm that doctors take an oath to. I think we could have something similar when it comes to the use of AI in healthcare. So really doing our best as professionals to ensure that we're trying to minimize any type of potential patient harm as best we can, with the knowledge that we're going to learn things that will make it even better and even safer as we go forward. But I'm very skeptical when it comes to constraining AI, because there are things that AI could really benefit humanity on, that if we do kind of constrain that innovation, it's not going to be good for any of us. Um, and then I think too, when it comes to just some of the precedent that has been set as well, AI is not the first kind of disruptive that we've had things like electricity, we've had the internet. And I think back to both of those technologies, like what would have happened if you had responsible electricity or responsible internet? You probably wouldn't have had the type of innovation that we see today.
Yeah, that's such an interesting lens to view it through, because I mean, yes, the internet was super disruptive, and to think about what would have happened had it been stifled. Yeah, that's a really, I'll have to reflect on that. I'm curious if you've seen any of that stifling in on the payer side, like just in your work, or have you seen that sort of play out in real time, or do you feel it's more still in the innovation, let's dream big, let's see where it goes kind of space?
I'll even make it bigger than the payer side, but just the healthcare industry in general. I think the one area that is still challenging to innovate using AI is in the direct patient care space. And I think there are obviously legitimate concerns around it, because if it makes an incorrect recommendation, that could potentially harm a patient. But I also think that we as healthcare professionals need to think more holistically about what it is that we're currently doing today and where AI could help. So a good example of that is, there are hundreds of thousands of medical errors every single year, and many of those result in pretty severe patient harm or even death in certain cases. Now, if we could apply AI to something like that and actually improve upon it, why would we not want to use it? And so that's always the question I have, where, we don't judge what we do from a human standpoint as rigorously as when we're trying to judge an AI solution. And I think it's kind of unfair not to have that parity between both of those. So
Mhm.
that's just one example that comes to mind. I mean, there are many others. And I also think too that patients are really going to start to demand it once they find out what these solutions are and how they can help them.
Yeah, and it almost is going to, at least in my mind, become just sort of the expectation in healthcare. Like,
Hmm.
banking, the banking industry, a million years ago. I mean, all of the online banking was new, but now it's just that's what we do. We bank online. So
Right.
we'll sort of eventually go in that same direction where AI just becomes part of care delivery, part of health plans, part of the provider side. I mean, part of each component of healthcare, and that just is. We can't remember a time when there was an AI kind of thing.
Hmm.
Like I can't remember before Google Maps. What did I do? I don't know. So it's like that same kind of thing. I think hopefully we eventually shift in that direction.
Right.
So I think it's interesting because your academic background is in philosophy, which is obviously very different from data science. So I love that sort of that dichotomy of both sort of sides of the brain. So how has your education influenced your approach to data and analytics, and what unique perspectives do you find that you brought from the sort of philosophical side of your studies?
Yeah, philosophy has really helped me learn how to think and how to think critically. So having the right reasoning, understanding logic, and being able to use data to make decisions. I think where I found it very applicable to disciplines like AI, one area is around just ethics in general. There's a whole kind of subsection of what they call AI ethics, and I see that as kind of almost redundant because ethics really applies more to human conduct, and AI is a technology that people use. So AI ethics should really just be a part of what we think about in terms of traditional ethics. There doesn't need to be that difference between them. And then I think the second area is just around things like artificial general intelligence, and when you hear about robots kind of taking over the world, we don't truly understand human intelligence at its core. And so how can we really think that there's going to be this artificial general intelligence that's going to be, kind of quote unquote better than all human intelligence? So I think that there are ways where philosophy has helped me kind of think more critically about these areas, and not given to the hype, or not given to some of the fear-based tactics that are being used around AI, but really to kind of have that critical view and try to stay as objective as I can.
Yeah, and I mean, you bring such an interesting perspective, I think, with that philosophical background, because to not get caught up in the hype in the past, 2 years is I would say a testament to having the sort of duality of asking the bigger questions and understanding the bigger picture of where it's going, or the possibilities, versus getting into the fear-based types
Mhm.
of talk tracks and LinkedIn posts and all the things that people sort of just spiral into. So yeah,
Right.
thanks for sharing your perspective. I think you have a really unique dual perspective. And then also I think the health insurer side is also really interesting, because we usually think about AI in terms of physician burnout and helping with nurses, and I think on the provider side and related to patients. But I think bringing that payer perspective in is also equally important, because it's a part of healthcare. So
Mhm.
thank you so much for sharing your perspective with us, and we appreciate all your insights.
Yeah, thank you for having me, Jen.